comfortable? Well, today we are going to be examining your pores. I remember from Dr. Whispers that she was quite preoccupied about your pores in your past session. Yeah, the same problem with dryness and not able to maintain moisture in your pores. So she sent you with me. Let me present myself. I am Dr. Susurros, which I am a specialist in pores and in troubles that are directly linked to this part of our faces. Now we're going to be doing a very, very close inspection of your face, especially the pores in your cheek area. Is that okay? Just don't want to cross any boundaries that you might have, but I'm sorry, I need to be quite close to your face. Is that okay? Very good. Well, let me first assess the issue at hand. Now, most of your problem is located around this area, right? Yeah, I do notice here. Do you tend to scratch your face? Do you get itchy? Okay. Well, definitely we need to treat that. Could be maybe even a allergy reaction of some sort. But definitely I can notice that patch that Dr. Whispers has been referring to. She's been applying a lot of products on you, right? Sending you home with creams, serums. In your medical history, I do see that you've been following the instructions quite well, so thank you about that. That means that they are not the correct product for your specific issue. Well, I want to start with a test. I'm going to use a series of products that I believe is going to give us a reaction. If your skin reacts to these serums, it's telling us that there might be an allergy or a bacterial issue that has been located in your pores. You've been having a lot of pore detox too, right? With mist, warm mist. Okay. So I want to start first with a generalized allergy test. I'm going to make sure that there are no bugs that are hidden in your pores. There are these tiny ones that love to feed on dead skin cells and make their home those pores. Okay. Now, none of this test is gonna hurt. It's not gonna feel itchy or anything like that, okay? Very good. So, this first is gonna be applied in the cheek area. We are looking for a reaction of a redness or maybe a ring into the area. If there is a ring present, it's telling us that there might be a bug hiding there. Hopefully not. Okay, try not to move, please. Very good. We are just gonna apply it directly here. Good. We're gonna give it a couple of minute mark, okay? You shouldn't be feeling any type of itchiness or burning sensation at all, okay? Quite important. Let me check here in your information. Okay, I do like that you have been having detox in the past. Seems that it helps for some time, not all the time. It always comes back, right? Of course. I'm so sorry. It must be very, very frustrating. Okay, let's take a look. Normally the reaction is not being able to see on the naked eye. We have to be very close to it. Please don't move, okay? Okay. No redness located. Color seems the same. No ring reaction. Okay, definitely there is no bugs in your skin. That's good. Quite good. Let's clean that area. There we go. Now this next testing will be to determine if you have allergies. Well, it's quite generalized because there are millions and millions of things that can cause allergies. The serum that we have here, it's something that we try to recreate with the major reactors of allergies, especially in the face. And 9 times out of 10, we get a reaction, but it's quite hard to determine which one it is. That's when we have to take a biopsy of the skin. Okay, let me just prepare this one. Yeah, actually today is my day off. That's why you see me so casual. Don't worry about that. It's because I'm going on a trip. Tomorrow we have a medical event that I must attend. I will be a speaker. So Dr. Whispers told me that you were a very special case. I couldn't say no. So I'm sorry that I'm not quite formal as you will expect for a doctor. Okay, now this test might feel like a tingly sensation, like something is touching you around there, like tingly, but it shouldn't hurt, okay? So just be aware of that. Let's apply it here, like that. There we go. Now, as I was telling you, this is very generalized, so I just want to know if we're going to have a reaction. We have it. We're in a good way to find it, okay? And as I was telling you, I'm not going to be around for a week, But if we get a positive reaction here, I'm gonna expedite the biopsy and send it directly to me wherever I am, okay? And I will be seeing you next week. Okay. It's applied. Normally takes a few minutes to react, okay? I'm gonna put here that you're gonna have an appointment with us. Oh, whoa. Okay. It's reacting quite fast. So yes, definitely we have a problem with allergies, and it's something that Dr. Whisper couldn't catch because it's not really in the spectrum. Okay, I'm gonna have to remove that before it gets worse. Yep, it's reacting. You're getting itchy, right? I'm sorry. Okay, this is to relieve it. There we go. There we go. Yeah, I'm sorry, so itchy. Let me just apply this all the way. Very itchy, right? Don't touch it. I'm sorry. This is gonna help with that. You're gonna stop feeling that sensation in no time. And I'm gonna clean it thoroughly, okay? I'm gonna use my cot paw, my patient's favorite. Yeah, it's quite cute. Huh? Okay, try not to move. Okay, I'm sorry. I'm gonna move you a little bit, okay? I want you to be in this position. Try not to move, please. Now, let's try it again. That was a violent reaction and quite strong, to be honest. I haven't seen one like that in so long. Okay, close your eyes, please. Good. 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 That's gonna make you feel better. You're still not over? I cannot tell you exactly what it is because we need to do a biopsy. I'm gonna put your appointment for next week. Normally the result from the biopsy should be ready 2 days time, 2 to 3 days time, and I will be back on Friday. That's when I'm gonna be able to see you again. I'm leaving a note to my assistant and my head nurse so they expedite this. Now I'm gonna give you also serum that is gonna prevent any further reaction. It's generalized, it's not a cure, okay? Just so you know. There is a big chance that might not work, but it's gonna help in case that you have a flare-up. Okay. Let's gonna do the biopsy. We're gonna scrub that area. and send it to the lab. I'm going to pinch you in the area and take a little bit of your skin. I'm going to numb it first so you don't feel any pain. Okay. Like that. Very good. Now it's just like scissors. We're gonna take a little part of it. It's gonna leave a tiny scab, but that's okay. Okay. We're gonna try not to move. So next time I'm gonna see you in my consult office, and hopefully we're gonna have the results. Okay, I have it here. Did it hurt? All right. Okay. Now I'm gonna be a little bit to the back now, since we are done with it. Okay, so I was telling you, your problem, it's very tricky. It's not impossible, but it's very tricky. I am actually gonna talk with my colleagues when I'm going to this place that I was talking to you about, and hopefully we can brainstorm on things that it can be. They're gonna give me the results again by 2 days, so I'm gonna have enough time to talk with my colleagues and find a real solution for you. And when we have the appointment, we might have something that is gonna completely stop that dryness and the itchiness, of course, that you have, that is quite bothering for you. Which is the main goal, to make you feel better. So I'm sorry that I had to do the consult here in my home. It's quite late, but it was an urgency by Dr. Whispers, and she is a dear, dear colleague of mine. Couldn't say no, and you're a very interesting case, and I really want to help you. Want to help you find out what is going on and make you feel better, because I know that your last crisis was a lot, right? Especially during this season with the weather changing, it feels like you just want to cry your skin out. I'm sorry, just so bad. Okay, now you're gonna be taking home this cream. Now, again, this is not a solution. This is not what is gonna help you resolve the problem, but it's gonna numb it. It's gonna make you feel like it's a band-aid, okay? So whenever you have a reaction, you're gonna get a little bit of this and apply it really generously, as much as you can or you want. Let's say that your reaction is so strong that you feel that sensation that you had earlier. Remember that it was so bad that you want to put as much as you can. Okay, don't worry about it. The moment you start feeling refreshed, more calm, you can take it off with a clean wipe. And the product should be inside your pores, but remember, it's not a cure. It's just to numb the areas, like a little band-aid. Very important to come to your next appointment. By then, with the consult of my peers, hopefully we're gonna find the solution. Do you have any other questions? No, not at all. You're welcome. I will see you in the next appointment, okay? Please take care, and here it is. Whenever you need it, just apply it. Okay? Yeah, just from the same door. I will back you. Let's go. Hello. Good day. I'm ready for you. We are gonna be doing your fantasy makeup. Okay, I was taking a look into the picture that you sent me with our email, and it seems that it's a lot of jewelry that you want to have. Oh, it's for a concert. Oh, how fun. So you want it to be very show off, very extravagant. And exactly as in the picture. Yeah, because I was looking into what I have for the applications, and I have something that I think resembles a lot what you show me in that picture, which will be this one right here. A lot of little hearts, diamonds, some ribbons, some roses too, and other circles. This is what I normally do for my bracelets that I make, but I think it will work perfectly for what you want. And I'm sorry, my kitty. I also got this ones here. Let me just pull it off. Oh, can you wait me a little second? Let me just take him out because he really wants some attention. And that way we cannot work. Yeah, this is Miga. See here, cutie. Yeah, let me take him out, and I'm gonna wash my hands so we can start. Okay, 1 second. I'm sorry about that. Yeah, Kitty wants attention, and when he wants attention, I cannot do anything. Okay, let me clean my hands. So, oh, sorry, another question. I have my air conditioner on. I'm sorry about the noise, but it's, the middle of the summer, so hot in here. Hope it doesn't bother you that much. Well, this is the other applications that I have that I feel it will work perfectly, especially around the eyes where the picture has them. Let me show you this one. It's really, really pretty. The colors are not the same though. I don't know if it's that an issue with you. It's like a rose gold color. Very, very subtle. I don't know if you can appreciate it here. The tone. Yeah, it's something that's gonna work for you. Okay. So we're gonna be doing first your eye makeup. And you were telling me that you want something fresh and soft, as in the picture. So you don't want any foundation? I can do foundation and then apply the skin glue that is gonna help with what I'm gonna be putting on you. There is no issue with that. No? Okay. So we're gonna be using these colors that are perfectly for that type of concert where you're maybe jumping or it's a little bit hot and you're moving around. This just works perfectly for that because it has a lot of pigmentation, so it's gonna last longer. Okay. Very good. So close your eyes, please. I'm not doing your eyebrows right now because in the picture it shows that the crystals go along the eyebrow. Is that okay? I don't think it's gonna mess up with your eyebrows or pull them out. When you remove them, you're gonna use micellar water, and that is not gonna pull your eyebrows. But if you do it yourself without any makeup removal or micellar water, you're definitely gonna pull out some eyebrows. So you really need makeup removal for that. Yeah, very good. Let's put it here. I'm gonna use this color, it's so pretty. Look at that. Oh, I love that color. How it shimmers. Very pretty. No, the crystals are not gonna fall down with sweat or anything. The only way that they're gonna be removed is unless you take them off by force or with makeup removal. But I don't recommend you to do it by force, because if they are in the eyebrows, you're gonna pull out your eyebrows, and if they are in your skin, it's maybe gonna leave a mark and hurt a little bit. Yeah, because this makeup glue, it's quite strong. It's what artists and singers use in their concerts when they put on all this makeup crystals. So it's the same thing. It's made to be strong and last. So you gotta be careful on how you take it off so you don't hurt your skin. Okay. The only thing that I'm gonna do with your eyebrows though is style them a bit, okay? I take off the overgrown eyebrows here. And then I start applying the crystals. I'm going to be cutting a little bit, the overgrowth. Okay, not much. Oh, I lost my spoolie. Okay, ready? There we go. So as for the glue, as I'm telling you, it's quite strong. So we're gonna try not to mess it up. We're gonna start with the eyebrow applications. And I'm gonna put the glue now. Okay. Now it's bright red, but it's just the color is gonna look clear once it starts drying out. This is so I know where it is applied. Okay, we're gonna be doing first the eyebrow area. Now I'm just gonna ask you to stay still so I don't miss on applying them. Okay. Okay, gonna apply a little bit of pressure. 3, 2, 1. Okay. And these are very, very cute. But kind of slippery. Okay, ready? Very good. 3, 2, 1. There we go. No, it's not gonna happen anything if you, let's say, scratch your eyebrow, you feel itchy. No, unless you're really trying to pull it off, that's when they fall out. Otherwise, you're safe. You can scratch and do whatever you want. Yeah, so I was telling you, this glue is quite strong, specially made for mobility, for sweating, so you don't have to worry that they are gonna fall out. Okay, let's put it right here. Three, two, one. Good. Okay, I'm trying. If you can put your phone like this with the picture, so I can get the reference here and there. Okay, good, thank you. Yeah, you can continue doing what you're doing. I just needed to see it again. Okay, let's apply here. Now in between, it has little tiny dots. For that thing, we can use this one. These ones are little ribbons, clear ribbons here, as you can see, very tiny ribbons. Or maybe this one too. I think it's adorable. But let's go with the tiny ones. Yeah? So it resembles more with what you want. Which will be these tiny ones right here. Okay. Let's try not to move. Good. These ones are faster to apply. There we go. Let's go with the side. Three, two, one. Oh, sorry. 3, 2, 1. Good. Three, two, one. Good. Three, two, one. Good. Go with the little ones. Okay, starting to dry it out, so I want to be fast with this one. There we go. They look really adorable. And believe me, once you're in the concert, I guess there are going to be a lot of lights. The sparkle is going to be awesome. Very, very cute. Now, let me see the picture. They have ones in the middle too, which I think we're gonna be using this ones. I think the rose will be better. It goes well with the theme, and maybe some little hearts and circles around here and here. It's going to be adorable. Okay, let me just pass it on here. And let's apply the glue. Now there is no redness present, so that means that there is no signs of allergies. Okay, so we're going to apply in the middle, right there, and on the sides here, following your eyebrow line. There we go. Now I just see in the lips that there is, it's like glitter, isn't it? I don't know how comfortable you are with that. Let me show you what I have here. I have all these types of glitter here, especially this one. I think it's the thing that resembles the most to the lip area. But are you gonna drink or eat during that? Might be a bit uncomfortable, I don't know. This is safe, even if you for some reason eat it, it's completely safe. It's what they put on food, like on cakes, so it's completely safe. But it's definitely something that you're gonna feel. It's okay? Okay, let's continue with the one in the middle. Three, two, one. And the ones in the side. Good. There we go. Looks so adorable. You also wanted fake lashes, right? Yeah. Yeah, that's gonna give you the touch. Okay, let me see the ones that I have that I think is gonna go well with this. 1 second. I believe I have one in a specific that is gonna be perfect for it. Might feel like it's too much, but I think it's gonna work perfectly. Okay, I'm gonna give you 2 options. Let me know what you think. This is the first option. This is what I call a normal lash, as you can see here. Then we have the long ones. These are the bossy ones. I do believe that these ones will be much better for this, since you're going for flashy, extravagant. I do think this is something that is gonna look well, and we can add some glitter to the tips. You're not gonna feel uncomfortable because they are so long, so they are not gonna be touching your face or anything. So I do think these ones would be the perfect ones. Yeah, very good. Okay, let's do your lips. Do you want the same color as in the picture? Okay, so that will be this tone of matte color. Okay, good. We're gonna do these ones. There we go. Now we're gonna go with this type of glitter here. Ready? Oh, I'm sorry, I forgot to put the glue. Oh, where's my brain? So the glitter is gonna be just around your lip like a liner, lip liner. Okay? Try not to move. There we go. Now let's go with the glitter. Try to go fast with this. I'll be a little bit closer to you. There we go. Oh, actually, looks good. I was having my reservations about this, but it looks adorable. The glitter, the shimmer it has, so looks great. Try not to move your mouth at all for the next 2 minutes, right? Or open it. After that, you can do whatever you want. Now, even if you lick your lips, there's nothing bad is gonna happen. It's non-toxic, this glue. The glitter too. And it's not gonna fall out with saliva or anything. Even if you kiss or something, not gonna fall out. It needs to be removed with makeup removal. Yeah, it's the only way. What you might want to avoid is maybe with your teeth doing that. Yeah, that if you do it with a little bit of force might make them fall off. But that's it. But regular drinking, eating, unless you're pushing the food strongly to your lips, but normal eating, drinking, it's fine. There we go. And let's go with the fun thing, which is the lashes. Oh, that looks so pretty. Yeah, it looks so pretty. How are you gonna have your hair? Oh, you're gonna bring a wig? Have fun. Okay, so I'm gonna put extra strength glue on the on the lashes so they last longer. Okay. No, not the same. Not the same as the other thing. It's not for the eyes. Okay. Let's put the glue. As you can see, are very, very thick. We're gonna cut it to your eye length. Okay, eyes closed. Good. 3, 2, 1. Remember not to open your mouth yet. Go with the other eye. Okay, ready? 3, 2, 1. Good. Very good. Now keep your eyes like that. Let's give it a little minute. I'm gonna put a little bit of blush. Yeah, blush needs to be a little bit stronger than normal because of the whole makeup look. Now you can open your eyes and let's do a little exercise with your mouth. I don't want the glitter to fall out. Try to do this. Very good. How does it feel? Is it uncomfortable? Especially around this area. Does it feel good? I can move it a little bit. It's okay. Okay, so we are done. You can take a look at yourself. What do you think? I think it looks fabulous. Perfect for any concert. I'm so happy you liked it. No, it was my pleasure. And hopefully you can send me some selfies once your whole outfit and wig is on. I would like to see the final result. Of course, it was my pleasure. Thank you so much. And well, have fun. Remember to send me the selfie, okay? Very good. Thank you so much again for coming to my salon. Bye bye.